Well, good afternoon, Will County. My name is Pam Ford, and my organization is having a one event, two causes. Uh, and the name of that event is Pink Saturday. We're having a breast cancer / diabetes walk. And the date for that event will be, both events will be on October 8th from 9 to 10 at the downtown Old Courthouse. That's where we'll be meeting. Now, we're doing this walk because a few things. First of all, we want to bring awareness to both breast cancer and diabetes. That's why we're doing the walk. We want to bring awareness by sharing information of what the importance of health screenings, cholesterol checks, exercise, diet, vision, dental care, and more when it comes to diabetes. Now, in our community, we know that in our community that we die disproportionately in our communities. We actually get diabetes disproportionately in our communities. I think a lot of times, as I talk to people, maybe just lack of knowledge, just not wanting to follow the rules of what our bodies are telling us. But at any rate, what I wanted to do, we have been talking with people that this has been affected by. For them, some of their loved ones have passed on, and then and some people that currently have it. Now, with full disclosure, I want to just share that my father died at 57 from diabetes and high blood pressure. He died at 57. And in December of this year, it will be 25 years since he passed. Now, he was going back and forth to the doctor off and on for years. Never once did any doctor say, you have diabetes. Now, was he eating right? He smoked, he drank, he did all those things. But never once did a doctor say diabetes. And when he went to the ER and they said, oh, well, his blood pressure is up to over like 600 and his diabetes is, sky high. And everybody was like, what? Nobody knew because the doctors didn't tell us that. And one thing we did learn over the years is that blood work tells everything. So we didn't quite understand what happened regarding that. But I said, I am now 55. And I'm thinking about, here it is in December, my father would be gone 25 years. So, 25 years, and I'm at the age a couple years shy of the time that he died and the rest of my siblings. So we think that it's important to be able to have this conversation, to get some accurate information and what you should do to talk to, the questions you should ask your doctor. And how to really maintain, if you do have diabetes or high cholesterol, how to maintain it. So this morning I have with me Dr. Dolly, and she said I can call her doctor. She said I can call her Dolly because that's what everybody knows her as. And she is she practices at the Will County Health Department. So Dr. Dolly, first of all, welcome to our program. We are so happy that you decided to come on and share your knowledge about this disease, because it's totally preventable. And a couple of things I just want to share before you start actually talking is, I had did some research, of course, and, looking about what are some of the things that you should ask your doctor. For those people that may not come to you at the health department, they may go to their own physicians. What are some of the things that they can ask their doctor? And so these are some of the questions that I'm going to ask you. And I just want you to answer them in your own way. And then we'll share additional information about what you're doing that's so phenomenal at the health department. So the first question is, what is diabetes and how can a person be tested? What health problems does it cause? And what types of diabetes are people at risk for? And how can diabetes be treated? So those are just a few of the questions. So I'm just going to now just open up the floor and just let you speak. And then we're going to sit back and we're going to listen. Dolly.
Okay. Thank you very much. Good morning, people of Joliet or Chicago or Illinois, wherever you are joining us today. I'm really thankful. I'm grateful for Miss Pamela that reached out to me. My name is Dolly Lgiebor. I'm a nurse practitioner here at Will County Health Department. I do adult medicine in there. And my best things that I like to do is diabetes. I love diabetes. The reason why I love diabetes is because Most of the people that I deal with are African Americans. They are also Hispanic population also, and also Africans. And when you look at it, most of these diseases, high blood pressure, diabetes, cholesterol, affect us. One, why did they affect us the most, right? People always ask, is it genetic? Is it environmental? Is it because of the food we eat? Is it lack of exercise? Being obese? Actually, all of these things can be attributed to you. It can contribute to you having diabetes. Genetic can play a big role in you becoming a diabetic also. We have different type of diabetes, right? We have gestational diabetes that affect women that are pregnant. We have type 1 diabetes also that affect juvenile, as soon as young as you can think of. That means that pancreas is not producing insulin. They have to actually inject themselves with insulin in order for survivement also. We have type 2 diabetes. Your pancreas is making insulin, but the body is not using it the way it's supposed to process it. What contributes to that? You being obesity, right? Inactivity contribute to it. Genetic contributes to it also. If we can have all those things in check for us, we can then start eliminating the risk for diabetes. Also, family history. If you have a family history, of diabetes, I would tell my patient to start screening, or anybody to start screening for diabetes. I like to have the history. If I see someone that is obese, I screen them earlier before that 40 years old. And what can we do? What can we do since diabetes is ravaging my community? Is ravaging my community, and that is where my passion comes from. I believe that we can solve the war on diabetes. We can fight it. Diabetes should not be causing us to be losing a limb. Diabetes should not cause us to be having a stroke. Diabetes should not be costing us costing us our life, right? If you have diabetes, guess what? Diabetes affects every part of your being. The income you are making, guess what? Someone that have diabetes, they start thinking, how can they survive it? One, we also have to take the stigma of you having diabetes that we have to put you on insulin, because that is actually what scares a lot of people the most, insulin. But there are a lot of ways diabetes can be treated in our community. One, once you are diagnosed with diabetes, even before you get there, write your question down when you're going to go see your doctor. What question do you want to ask your doctor? When should I get screening? What are my risks? What are my risks that I need to address before I get there? Write all those questions down. What can they use? Or what can I take if I was diagnosed with diabetes? What can I take to solve that? Is the only medication? Can diet also help me solve my diabetes? All of those questions, I want you to write it down before you come and see me. When you come and see me, the first thing I do, we put you in a room, we do the questionnaire. If you have any question that you've written down, I give you the opportunity to ask me that question. Then we start ahead. We have to calculate your BMI, which is calculating your height and your weight. Guess what? If your weight is more than your height, that is giving me one risk factor right there. If you also smoke, that is giving me another risk factor also there. If I find that the family also have a history of diabetes, that is giving me another risk factor. All of that fracture into it, I will not screen you for diabetes. And then once we screen you for diabetes, there are tests that we can use. Remember, we just did the questionnaire, right? And we find out that you have all these risk factors. Now, we now go ahead and draw your blood. What type of blood do we use? We use your fasting blood sugar level. It needs to be on a certain level. And we also use hemoglobin A1C, which measure your blood sugar for the past 3 months. 3 months. So my patients, some of them come to me, and when they check their blood sugar in the office, they say, oh, my blood sugar is good. I cannot be a diabetic. But when I do the hemoglobin A1C, guess what? Hemoglobin A1C of 6.5 and above actually puts you as a diabetic. If you have hemoglobin A1C of 5.7 to 6.4, that puts you in as pre-diabetic. Now, when you are diagnosed of pre-diabetic, that means you are not there yet. But if we don't change the way we eat, our risk assessment, if we don't change that risk factor, that means down the road, within 6 months, depending on your level, that person might become a diabetic. Now, how can we change that risk factor? If you are pre-diabetic, I want you to start exercising. Exercising is the most easy thing that I would start with. Then exercising every day, even though you cannot exercise every day, I want you to at least do it 3 times a week. If you can put in 150 minutes of exercise in a week, that will help us a lot. I understand we are busy all the time. We are like in a fast generation right now. Everything is like microwave. We want it. Well, they will tell me I don't have time to go to the gym. Guess what? I'm not even asking you to go to the gym to do that. If you sit at your desk, I want you to walk around in your office. If you sit down, I want you to stretch your hand up. Stretch it up and down. Do the same thing. On the other hand, if you are sitting down, raise your leg up. If you can count 30, if you can do 30 for me, you are moving. You are physical active. It does not mean you have to go pay $60 for gym. I all understand. Cost of living is getting high. You're telling me to exercise and I don't even make any money. Yes, I am not asking you to go to the gym to go enroll, but I'm telling you to do a couple things within your surrounding. Even when you get home, I tell patients to me, when you get home, when you are done eating your dinner, I want you to walk around in your apartment or in your house just for 10 minutes. That is all I'm asking you for, to get that exercise going. Because guess what? When you exercise, it helps decreases your stress and also help decreases your blood sugar. It makes your body uses your blood sugar right, thereby lowering your blood sugar. Right. Exercise is the most easy thing, but is the most difficult thing. Now, let's tackle the next one, which is the diet. Oh my goodness. Diet. I hate the word called diet. You know what I call it? I call it healthy lifestyle. Healthy lifestyle. Think about it as your purse. You put everything in your purse, right? That is the way I tell my client, my patient, to look at eating, right? You don't want to put junk in your car, in your bag. You don't want to do that. Then why do you want to put junk in your body? You see what I'm saying? Why do you want to put junk in your body? So if we can start eliminating certain things, cutting it down before we eliminate. Let's say if you eat 2 slices of bread, why don't we cut it down to 1 slice of bread? A lot of people like to eat white bread than wheat bread. Why don't we just, try wheat bread? We try 1 wheat bread today, try the white bread tomorrow. Keep on substituting it little by little. If you're eating 1 slice of 1 bread, cut it down to half. Eat half a slice of a bread, white, and eat a whole wheat bread. So you're gradually weaning yourself up from the white bread. And then you revert to 1 wheat bread. If you like to eat rice, hey, like we Africans, believe me, there ain't no African house you will go that you will not see that rice. There ain't no Hispanic place you will go restaurant that they will not serve you rice, right? If you like to eat rice, just like me, I'm African. I want you to change that white rice. Mix it with wheat rice, the brown rice. If you want to cook a cup of white rice, cut it down. Cook half brown. Then mix them together. You gradually weaning yourself up. Gradually, little by little. Guess what? That white rice, when you taste it, ooh, it start being yucky to you. You're not used to wheat rice. Now let's talk about vegetable. I love vegetable. The way you can fight pre-diabetes and diabetes is more vegetable. Government said we need to eat more vegetable, right? There's what we call the 9-each plate that the government wants us to use when you are diagnosed with pre-diabetes and diabetes. Now, in that plate, majority, half of that your plate needs to be non-starchy vegetable. What are non-starchy vegetable? You are talking about salad. You are talking about collard green, mustard green, turnip, right? Spinach, cucumber, carrot, mushroom. Pack it up. Yellow pepper, green pepper. Put everything all in there, okay? And you know, we African, we can throw down now. Let's throw down. Let's cook that vegetable. Let's cook that mustard. You know, put it on your plate. When you put it on your plate and put the rice by the side, when you mention the feast of your rice, of your hand, that should be the size of your rice you should be putting in your plate, right? And also, that is the feast of the meat that you can put on your plate. And guess what? You have a perfect plate right there. Perfect plate. So you have more vegetable, you have less carbohydrate, right? And then you have your protein. And people will ask, what about soda? Oh my God, you're taking the fun out of life. Soda, soda, soda. I say, you know what? You can drink diet soda, but you cannot drink it that much either. Just to drink diet soda does not mean that you drink it for breakfast, drink it for lunch, and drink it for dinner. Or some people will say, oh, what about Kool-Aid? Well, Kool-Aid is pure sugar. And I'm trying to get you off that sugar, right?
Yeah.
So we kind of cut it down little by little. I understand groceries are very expensive, but there are a lot of things we can do to better bring that sugar down. And there are a lot of people, a lot of places you can go in the community, like this place called Hands of Hope, where you can go in there. When you are done buying your grocery, guess what? You have a lot of choices of vegetable. They give you things there free. It's here in Joliet. You can also go there. Some people will say, well, I don't like to go to the shelter. Guess what? Make not the shelter, but this other place in the community that you can go in and get food. Yeah, the food pantry, right? You can go to the food pantry and go in there and make healthy choices. Well, some people say, I don't just have time to cook all the time. Guess what? Even when you go to McDonald's, you can get salad. You can get your salad. You can still get your sandwich there. They do have the sandwich. Let me tell you, everyone, I love McDonald's fries. But does that mean that I have to eat the whole McDonald's fries? No. I'm not taking the food that you love out of your body. No, 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 no. I just want us to cut it down and to eat smartly. That is what I am trying to do. Because guess what? If you put all these things in places and you are diagnosed of pre-diabetes, if you put them in places, there is no way you will turn to diabetes. You will have diabetes. Because once you have diabetes, guess what? There ain't no turning back now. People say, do I get cure of diabetes? No, you don't get cure of diabetes, but it can be in remission for you. In the sense that you still have diabetes, but it's just control. Now, when you have diabetes type 2, that means we try you on medication first, and the name of the medication that they start, your doctor will decide that. I'm not going to put the medication out here because everybody is different. You discuss with your doctor will look at the medication that fits your body and that fits you, and then they will start you on diabetes. Some people will say, oh, once I'm diagnosed with diabetes, that means I have to be on insulin. No, you do not have to be on insulin. Insulin is far, far away from me. I do not put my patient on insulin. A lot of us are afraid of the needle. A lot of us are saying, well, once they put me on insulin, I cannot get off. No, don't think like that. You can actually get off from that insulin if you work very, very hard. You work very hard on your exercise, on your food. and on yourself. Because guess what? Diabetes take control over you. Diabetes can cause depression. It can make your depression become worse for you. And once you have diabetes, here comes high blood pressure also. And then here comes cholesterol. I would rather we control all of these things before we start suffering the complication of diabetes down the road. What are the complications of diabetes? You can have a stroke in there. You can have kidney disease in there. Also, even your limb can be cut off. You can be trucking and the teeth can fall off because the blood sugar sits on your gum and it affects your gum also. You can also become blind also. You might be seeing, but internally, the artery feeding your eyes is already being affected by the blood sugar. And I do not want that. I've seen people with their limb cut off, with them being blind also, with them losing all their teeth. And these are 30-year-old. A 30-year-old should not be losing their teeth. A 30-year-old should not be having a stroke. If we can do everything to help bring this risk factor down, to help control diabetes in my population, in my community, believe me, I know I have won the battle. So the battle is still there. We can control diabetes. We can control diabetes by not leading to the complication. Diabetes does not kill. It's the complications that come out of it that kills. Because if you now have a wound, with diabetes, you're going to have prolonged wound healing because the sugar is just out there. If we don't heal that wound, guess what? It can easily go into the bloodstream. And when it goes into the bloodstream, here we go again. You'll be going in and out of the hospital, in and out of the hospital. Is that what I want for my patient? I do not want that. That is what I do at Will County. I try to teach people how to live their life better, how to become a better person in the society. I don't want my patient to die of diabetes complication. If I can do everything possible to help solve them, to help them before getting there, then I have done my job. So I also like to meet my patient. Not every hand is equal, right? I have to meet my patient where they are. If my patient cannot afford 3 square meals, guess what? I have to find out where they can get that meal and where they can get it cheaper for them and still be able to live healthy. That is what I do. And I am so glad that a lot of the patients right now in my community, they are doing great with their diabetes. So let's come out for that work. Let's come out. Let's share let's share our experience together. Let's discuss, while we're working. Let's hug ourselves. Everybody deserves love, right? And that is what we are just trying to do with that work. I am so pumped up. I am so fired up for that day. I cannot wait to get my sneaker on. Miss Pamela, thank you for inviting me. Thank you, because we can fight the war on diabetes together. And they said one is a majority when you have God with you. And I believe God is going to be there. God is always guiding us.
Absolutely.
So let's do everything possible within our community. Please, when you are listening to me and you are still confused about the war on diabetes, come check me out at Will County. Come check me out. I'm right there. We can fight this war on diabetes. Diabetes should not be killing my people. Complication of diabetes should not be sending them to their grave. Complication of diabetes should not be making their life miserable with depression. So we can do it. I believe so. We can. Follow the diet. Exercise 3 times a day, 3 times a week for 150 minutes. If you park your car at Walmart, I go to Walmart. Park far away. You are getting your exercise in. If what you are looking for at Walmart is in the front, turn around in the store and walk around and get there, right? You can do that. If you park, let's say, if you're going to a party now, park your car far away. Okay? Park your car. And if what's become worse, put on a comfortable shoe. If you say you don't have a comfortable shoe, go to all the local communities. You can go to Goodwill and buy a shoe. So that is all right now that I have for you. Diabetes is going down. Am I pump up? Are you pump up too?
Yes, I am. I surely am.
There we go.
Now, Dolly, how can people get in contact with you? Because can you just speak just for a minute or two about the class that you actually conduct at the health department, how people can get in contact with you?
Yes, we do have a class on Fridays. On Friday for diabetes patient. You know, you people in the community can also come there. They can call 815-727-8670 and just ask to make an appointment with me. Sometimes I get filled up very fast, you know, but we can always make it available for you. The CEO and my medical director, they have made the opportunity there for us to offer people, for us to offer patients and and people in our community to make the classes available to them. So when you come in, guess what? I want you to come with your shoe because we're going to go outside and walk. Even though you're in the room, you're going to get up, and walk around. And guess what? I like the lights in our clinic. When you sit for so long, the light will shut off on you. So it's telling you, hey, you got to get up and move around now. Okay. So when you are coming in there, when you call 815-727-8670, just ask for Dolly. And you say you just coming for the diabetes class, and they'll put you in. It's on Friday. It gets filled up so fast. It's from 8 o'clock to 12, and we are done. You're going to learn about food, about exercise, about medication, and how you can look sassy. Hey,
that's wonderful. That's wonderful. That is wonderful. I'll put that number at the end of this discussion too for people to be able to get in contact with you. And I think that, I mean, like they say, that or that all, folks. It's like you did it. You said it. I mean, there's nothing else to be said. It's all about choices that we make, and we have to make that choice to to have a healthier life. So for Dolly to seeing you at the walk on October 8th between 9 a.m. to 10 at the old courthouse downtown. Yay! We are excited. And those of you that's interested, please pick up the phone and call. If you want to learn more about the diabetes education that Dr. Dolly has, please pick up the phone and call, and I'll put that number again at the end of the discussion here. Thank you so much, Dolly. I appreciate you taking time out of your busy day to speak with the, with the community, and we look forward to seeing you on October 8th, okay?
Yes. Thank you very, very, very much. And my name is Dolly. I'm a nurse practitioner at Boone County. I do adult medicine. Come check us out there and come out for the work. I am super pumped, and God bless all the women out there. Shout out to all my women out there. I'm going to see you guys on that day. Come out with your shoe and let's go walking.
Yes, let's go walking. And look, you go walking and you have yourself a good weekend, okay?
And you too.
Okay, bye-bye.
Bye.